Welcome to Medicine Handy Point. Today our topic is jaundice. So we'll discuss how to take a history in a patient with jaundice. So first we will ask about the onset, whether it was sudden onset or gradual onset. Then we will ask about the duration of the disease. When did it appear? For how many days or weeks now or months? And then we will ask about progression of the jaundice. So after that we will get some clue where we are going. So it could be acute jaundice, subacute jaundice, and recurrent jaundice. So in acute, as you all know, most common cause is acute hepatitis, mostly viral. Gallstone disease can also cause acute obstruction and lead to jaundice. Hemolysis also causes jaundice, and acute Budd-Chiari syndrome also causes acute jaundice. Subacute will occur in weeks to months, while acute occurs in days. So in subacute, we will put pancreatic and hepatobiliary malignancies. Then we'll place intrahepatic cholestasis is usually slow in nature. The jaundice occurs slowly, and intrahepatic cholestasis is usually caused by drugs, caused by autoimmune hepatitis, caused by fatty liver. So we have to keep those things in mind. Then recurrent jaundice, it could be gallstone diseases can cause recurrent jaundice. Gilbert syndrome, which is a hereditary problem with the bilirubin glucuronide transferase. So there will be recurrent jaundice, especially when the patient is fasting or having any stress in form of infection, dehydration. Then once we have classified it into acute and subacute, then we will further ask associated symptoms with the jaundice. Like we will ask about fever, if fever is present, so it could be viral hepatitis. Then we will ask about nausea and vomiting, abdominal pain as well. Fever can occur in alcoholic hepatitis. It can occur in acute cholangitis and acute cholecystitis. In acute cholecystitis, sometimes there is inflammation of Hartmann pouch which compresses the hepatic duct. This is called Merisi syndrome. So Merisi syndrome actually present with acute cholecystitis and jaundice. Usually in acute cholecystitis there is no jaundice, but if there is Merisi syndrome, then jaundice can occur. Then we will ask about pain in right upper quadrant area. So pain usually occur in hepatitis, cholangitis, Merisi syndrome, which we just discussed, and Budd-Chiari syndrome. Next we will ask about pruritus. Pruritus will tell us about the cholestatic nature of the jaundice. Then we will ask about dark urine. Dark urine, which usually occur in obstructive jaundice, but it can also occur in hemolysis as well. So we have to ask about this as well, though it's not a very reliable thing regarding the confirmation of obstructive jaundice, but we have to ask this in a history. Then next we ask about the back pain. Back pain can occur in acute hepatitis as well as in hemolysis cases. There will be back pain. So these will be the associated symptoms which we will ask in a patient presenting with jaundice. We'll ask about fever, we'll ask about abdominal pain, we'll ask about pruritus, we'll ask about the color of the urine and stool as well, and we'll ask about back pain. Then the complication of the problem, like if it is a liver problem leading to jaundice, the patient may present with confusion, which confusion. So confusion has two problem relating to hepatobiliary system. So in two conditions, cholangitis can cause severe sepsis, which will present as a confusion, or hepatic encephalopathy can occur in acute liver failure, and sometime in a chronic liver disease, acute decompensation lead to hepatic encephalopathy. So we'll ask about the complication. Then we'll ask about bleeding from the gums or mucosal bleeding, GA bleeding, which are the complication of the hepatobiliary system involvement. Then we will ask for risk factor of viral hepatitis, which we know are sharing injections, tattooing, piercing, dental procedure. They can cause acute hepatitis B. Then we will ask patient having any exposure to patient with the acute hepatitis A, or travel history. Travel history is important because acute hepatitis A can occur after 4 to 6 weeks after exposure to the virus. So travel history is important during this period. Exposure to any patient with acute hepatitis is also important. So travel history is important. Exposure to patient with hepatitis A is important. So these are risk factors for developing viral hepatitis we should ask in the history. Then risk factor for cholestatic jaundice. So the risk factor for cholestatic jaundice will ask about any past history of gallstone, or will ask that any pain in right upper quadrant after eating, so which will tell us that there is some gallstone problem going on. We will ask about previous biliary or hepatic surgery, history of sickle cell anemia. Will ask that because it will cause sometime pigment stone, which will cause obstruction, and sometimes the sickle cell anemia present with hemolytic crisis as well. This is wrongly written. This is actually hemolytic crisis. We'll ask about ulcerative colitis, which can sometimes cause primary sclerosing cholangitis. So we'll ask in the patient that the patient has any problem with the bowel in a form of bloody diarrhea. Family history is important. The liver condition which can present with jaundice, like hemochromatosis, which is autosomal recessive disease, Wilson disease, Gilbert syndrome. We can ask about hemolytic anemias, like we mentioned earlier, sickle cell anemia, G6PD deficiency. Then we will ask about any herbal medication, or other than that, any other medication patient is using. We'll ask about hepatitis A and B vaccination, very important. In female patient, we will ask about pregnancy, and if the patient has a jaundice, then we will ask about preeclampsia, HELP syndrome, and we will also ask whether the patient has any previous pregnancy with these complications, because once they have these complications, they can develop these complications again in the following pregnancy. So we will answer about those stuff as well. I hope you like the video, and please subscribe to the channel.